Hello, everyone. Today we're going to talk about how South Africa became South Africa. The story of pharmacy legislation in South Africa is one of progress and change, mirroring the country's journey from a rudimentary healthcare system to a more comprehensive and patient-centric model. Let's start at the beginning. In 1928, the Medical, Dental, and Pharmacy Act laid the groundwork. This early legislation mainly focused on registering pharmacists and pharmacy premises, as well as regulating the importation, manufacture, and advertising of medicines. The emphasis was on dispensing and controlling medicines rather than on patient care. This modern legislation emphasizes a patient-centered approach, professional accountability, and the development of new practice areas for pharmacists. The Pharmacy Act of 2004 recognizes pharmacists as key members of the healthcare team, enabling them to provide a wide range of services. For instance, they can now play a significant role in the management of chronic diseases, immunization, as well as primary healthcare services. In response, the Medicines and Related Substances Control Act of 1965, as amended, came into being. It has moved from a system that primarily focused on the control of medicines to one that recognizes the broader role pharmacists can play in healthcare. This evolution is a positive step towards aligning South African pharmacy practice with international best practices and is geared towards addressing the unique health challenges faced by South Africa and its people. This act is crucial for regulating the registration, manufacture, and distribution of medicines. However, it's important to note that the control of medicines is not solely in the hands of pharmacists. The legislation provides for a multidisciplinary approach with input from various professionals, including pharmacists, doctors, nurses, and even consumers. Over time, amendments to this act have progressively allowed for greater professional autonomy for pharmacists. For example, pharmacists can now prescribe certain medicines and devices without a doctor's prescription, such as contraceptives and medicines for the treatment of minor ailments. They've also been given expanded roles in public health initiatives like the rollout of the COVID-19 vaccination program. However, by the 1970s, the scope of pharmacy practice had expanded, and in 1974, the Pharmacy Act recognized this evolution. It broadened the definition of a pharmacist, allowing for pharmaceutical services beyond dispensing. This included the provision of pharmaceutical care, which emphasizes a more holistic approach to patient care, taking into account the patient's overall health, not just their prescribed medication. This act also established the South African Pharmacy Council, or SAPC, as the statutory body responsible for regulating the profession. The SAPC is tasked with registering pharmacists and pharmacy premises, setting standards for pharmacy practice, and ensuring that pharmacists adhere to the ethical code of conduct. Post-apartheid, South Africa saw a need for reform in healthcare legislation to address issues of equity and accessibility. More recently, in 2004, the Pharmacy Act repealed the 1974 Act. In conclusion, pharmacy legislation in South Africa has come a long way. Thank you for watching. Please like and share. And don't forget to subscribe for more videos like this. Till next time.